Welcome to Vet Fraternity. In this video, we are going to talk about X-ray views, specifically about thoracic cavity, that how the lung patterns appear on an X-ray and what those patterns are and how we can identify those patterns or what lesions are associated with those lung patterns. So let's begin. First thing about an X-ray, you should be able to differentiate whether this is a left view or this is a right view. There are different landmarks that can basically tell us, even if the radiologist has not marked it left or right for you. There are different landmarks for when we talk about chest cavity, and there are different landmarks when we talk about the abdominal cavity. Abdominal cavity and its organs are not our topic of debate today, but what we are going to talk about is thoracic cavity. And from thoracic cavity, how we can see, okay, this X-ray is of right side and this X-ray is of left side. So basically, what happens in the right view, the crura of the diaphragm are going to be parallel, almost parallel, like this. But when we talk about the left side, the crura, the diaphragm edges are going to be non-parallel. So that is the only very important and very significant parameter or point or landmark that can tell you, okay, this one is left side and this one is right side of the lung. Okay. Next, you should know how whether this X-ray is a DV view or a VD view. So when we talk about the VD view, you are going to have the these two carura and cupula of the diaphragm as separate structures. You can see them as three different domes. But when on DV view, it is going to appear as one single dome. So that is a difference you can tell, okay, VD view or DV view. Okay. Third thing you should remember, okay, what are the lung lobe borders? How we define those borders. But before going into the bordering, I want you to apply the knowledge of previous two slides on this. I have mentioned that on the right side, the crura of the lungs are going, diaphragm are going to be parallel. So you see, this one is parallel. Similarly, this is a VD view. So you are seeing three different domes, but this one is a DV view. So you see a single dome over here. Okay. Okay. When we talk about the lung lobe borders, on the right side, we basically have three. One border is right cranial, second is right middle, third is right caudal. Similarly, if you see cranial, middle, and this whole is basically caudal. Okay, so this caudal, this middle, this cranial right. But when we talk about left side mainly has two borders. One is cranial and one is caudal. But only the thing is that within cranial lobe, they have divided this lobe into left cranial, left cranial caudal. Okay, so that is on the left side. And in between, they have an accessory lobe. Okay, but this is the view from VD. When we view it from DV, you're just going to have right cranial, right caudal, left cranial, left caudal. Simple. Next slide. Lung regions. Lung regions are very important to be known. There are basically three regions. This one is hilar region, then is central region, then is peripheral region. You might have read in many diseases, just like the fungus diseases, where the disease patterns are like hilar lymphadenopathy. So, or peripheral lymphadenopathy in the lungs, you have seen, because that means if it says hilar lymphadenopathy, it means the lymph nodes in this hilar region have been enlarged. So you're going to see the opacity is increased, opacity of the lymph nodes in this area. So this is hilar lymphadenopathy. So here again, this is basically the lateral view. This is a PD view. Again, why PD view, not DV? Because we can see three different domes. So hilar, central, peripheral. Again, this is the right view because the diaphragm pleural are parallel. Okay. After the regions, we have to talk about pulmonary vasculature. There is a fun mnemonic to make it easy. They say veins are ventral and veins are central. In this slide, we are going to talk about the veins are ventral. You can see this basically X-ray. There are these white structures are basically vessels. Now, how to know, okay, which ones are veins, which ones are arteries? Always remember, the above one is going to be the artery, below one is going to be vein. Artery, vein. So this one is of the right side and these two are of the left side. It's like right and left side, okay? So the two on the right, two on the left, and arteries are above, veins are below. So veins, arteries are dorsal, veins are ventral. If we go into the next slide, we can see veins are central. Like here, this is the previous slides was talking about the lateral view. This is the VD or DV view. Here, what we are going to see in the VD view, the veins are on the center and artery is on the side, that is like away from the center. Similarly, vein is on the central side and away from the center you find this artery. So veins are ventral, veins are central. You can see these two. Now this one, outer one is going to be artery and the inner one is going to be the vein. So these are just the landmarks you should know about before reading any X-ray about your animal. So next, okay, this is the bronchi. We know this trachea divide into bronchi and bronchioles. So bronchi appear on the X-ray as a long tube, either as a long tube or as a cross-sectional image. So when we talk about longer view, it's the term we use, it's called as tram line. But on its cross-sectional view, it appears as a ring, or we call it as a donut. So let's see these donuts and tram lines in the next slide. So this is an X-ray, and this portion that is highlighted is zoomed out over here. Now you see the cross-sectional images as rings or donuts. Meanwhile, the longer view as tram lines. Again, this is not that much white. The image is just enhanced for sake of learning here. This is going to be a little bit blurry. In the original image when you are going to see in the X-ray in your clinic, but that's how they are going to appear. And this is a normal pattern. Now talking about lung patterns, there are basically 4 lung patterns: alveolar pattern, bronchial pattern, interstitial pattern, and vascular pattern. So the first pattern is alveolar lung pattern. Alveolar lung pattern, how we are going to define it is, it is a generalized, it is basically characterized by soft tissue opacity of the lung. So the opacity of the lung parenchyma is going to increase. Border effacement of adjacent soft tissue, that it means that this alveolar pattern is going to be in such a way that any organ, just like trachea, that is in the middle of the lung parenchyma, you cannot see that. So the borders are going to be very light because the lung parenchyma is now getting increased in opacity because alveoli are going to get filled. So sometimes some other structures, or not only that, similarly the diaphragm, we know there is gas filled in the lung, so the diaphragm the border, the diaphragm border is also going to get dim. And what is a characteristic of the alveolar lung pattern? It's the air bronchogram. What is air bronchogram? Basically what happens that the air is still there in the bronchi, but around that bronchi, the soft tissue, the parenchyma of the lungs, the alveoli have increased opacity. So the background is all white, but the bronchi have air inside, so the background is getting whiter, and this is going to be a little bit blackish or like grayish contrast with the background. So that is air bronchogram. Let me show you, and you will understand it better. See this. Basically, this is the image of a lung having pneumonia, and this is also the image of a lung having pneumonia. This was taken a few days ago, and after a few days ago, this image was taken, or basically the pneumonia got worse. What happened? The opacity of the lung lobe, the cranial lung lobe, has increased. And when the opacity has started to increase, you can see clearly the contrast of the air inside the bronchi. So this is called as air bronchogram. This is also air bronchogram. This is also the air bronchogram. Similarly, if you see this is another case of an animal having non-cardiogenic pulmonary edema. We are not dealing with the case over here. We are just trying to see the pattern. So the pattern, there is increased opacity of this all area where there is edema now. It doesn't matter whatever thing is filling the alveoli, but alveoli opacity, lung parenchyma opacity is getting increased, and that's why we can clearly see a sharp contrast of air inside the bronchi. So this is air bronchogram. So you see the air bronchogram is just in this area, not rest of the lung is okay. So this is a alveolar pattern. Okay. Next we have is bronchial lung pattern. Bronchial lung pattern is characterized by increase in the number of bronchial markings. Basically what happens that sometimes calcification of the bronchial wall start to happen or things like that. So, or there is inflammation of bronchial wall. Based on any of these conditions, the bronchial walls start to get thick. And when they start to get thick, there are going to be again two patterns. Again, either tram lines or the donuts or rings. You can see both here and both here. Here the white arrow says talks about the donuts, and the black arrow marks the tram lines. In this image, the white arrow marks the tram lines of the bronchi, depicting bronchial pattern, and the black arrow is marking the bronchial ring or bronchial donut. Basically, the classic case for this is classic presentation of this pattern happens in feline asthma because it has the bronchial pattern. Again, one more thing, if you see, this is the right side of the right view. So can you see the diaphragm is having parallel lines? So this is the right. Next is vascular lung pattern. Vascular lung pattern is just characterized by abnormal size or shape of the pulmonary vessels. We have talked about the pulmonary vessels. Veins are ventrals, veins are central. Now there is one to two more things that always remember that the veins, vessels, either vein or artery, they should be of similar size. And one more thing, that they should be smaller than the thickness of the fourth rib. So you see both have, this is a normal one. This is the normal one. So they have the both similar size, similar diameter, and they are thinner than the fourth rib. But in this, the B view, you can see the both are getting a thicker. Okay. So this is basically vascular lung pattern. See, both are thin, In the D, the artery is thick. In the E, the vein is thick. Again, so all of these are depicting what the vascular lung pattern, because the blood vessels are having abnormal size. It doesn't matter whatever the cause is. Just like in this condition, you can see uh, um, the artery is getting blunt over this area at the end. So this is basically the case of pulmonary thromboembolism. There is an emboli over here that is causing back pulling of blood in the artery. So we are not talking about whatever the disease, underlying diseases, but the pattern is vascular lung pattern. So whenever there is going to be abnormal blood vessels, it is vascular pattern. So above, we have talked about four major lung patterns, but there are other lung lesions, or we can see on the X-rays also. So we will talk about those also. This is the lung lobe portion. Normally, sometimes the lung lobe, one of the lobe of the lung, because we have talked about, okay, lung has different lobes. So one lobe of the lung twists on itself, and because of that area gets pooled with the fluids and blood and everything, so that gets increased in the opacity. So this just one lobe, middle lobe, is now having sorry, this lobe is having increased opacity because of the torsion. Again, one more thing, this is the left side, so you can see uh, okay, this and this. Again, these are not parallel, so it is the left. Okay, next we have is nodular pattern. In this, you are going to have all nodules. Basically, this is an X-ray of case with the fungus. So it has nodular lesions on the chest, on the lungs. So and these are marked difference from the donuts or rings that we were having in the bronchial pattern. Again, this is the left view, so you can see the crura of the lungs are not parallel. This is the last one, atelectasis. Basically, it is called as a collapsed lung because of any reason. Just like in this lateral view, if you see, this is the case of pneumothorax. There is air in the pleural cavity that has uplifted the heart, and from above it is also pressing the lungs. So lungs have collapsed. So when they are collapsing, what is happening? Their opacity is being increased. And similarly, over this portion is also having collapsed lung. Either the animal was lying on this side for too long during anesthesia, it was pressed, or any reason, but this is the atelectasis, or collapsed lung. That's how it looked like. And oh, this one also left fluid-filled lungs. Basically, this is one of the characteristic or lesion with the in the case of pyothorax, that fluid fills, and as it is fluid, so because of gravity, it will settle down ventrally, and they form a fine wave. We call it a fluid wave. You can see this. This fluid wave is very, very characteristic of these kinds of pathologic conditions. So this whole area is filled with fluid, either blood, either just fluid, or just like pus. So this is fluid filled lungs. So that was all about lung patterns. I hope you understood. If you have any query, you can just comment it in the comment section, and don't forget to subscribe and share the video. Thank you so much.